Okay, so first things first, I'm going to go ahead and don the most appropriate PPE, make sure my scene is safe, and consider ceasefire precautions. Next, I'm going to check my patient's level of consciousness, make sure he's tracking me, if he's talking to me. If he's found unresponsive with no pulse, we're going to go ahead and begin CPR, but it doesn't look like that right now. Right now, I'm going to have my partner go ahead and hold traction, or hold the patient's injured arm. I'm going to go ahead and check CMS. Okay. So he has a pulse. Can you feel me touching him?
Yep.
Okay, which finger am I touching?
Pointing finger.
Okay, there you go. So after that, I'm going to go ahead and have the patient hold his arm. I'm going to go ahead and grab my SAM splint, go to the uninjured arm, and measure it out from here, while my partner holds his other arm. So we're going to do that. Go and bend your arm. Okay, now that we have the form, we're going to go ahead and put this under the injured arm. There you go. Okay. So now we're going to start wrapping it from distally to proximal. Making it loose enough for it to not cut off circulation. And once we get to the elbow, we're going to wrap around it. And if I see any voids, we're going to go ahead and put some padding in it. And once we get to the end, we're just going to go ahead and tie it off. Okay, now I'm going to go ahead and check CMS again. Wiggle your fingers. All right, feel your pulse. I feel a pulse, and go ahead and tell me which finger I'm touching.
That's my point.
Okay. So now that we have that established, we're going to go ahead and put a triangle bandage. So we're going to wrap this around now. How does that feel? Does that feel comfortable? Okay, so yeah, I want to make sure it's at the position of his comfort. Afterwards, we're going to go ahead and wrap this around him as well. So it's going to go under your arm. Sorry, under here. I'm just going to go ahead and reassess the patient. How do you feel, man?
Better.
Okay, and right now we're going to consider IV just for the pain medication and go ahead and transport him to the hospital. That concludes the joint immobilization.